And we're live. Hi, everyone. Thanks for joining us today. It's me, Jen
Yes,
from and
this is Roselle. Ace is still driving.
and
Yeah,
Audwin's at the cafe. So, ayan. Very interesting ang ating guest tonight. So,
yes. Oo nga para kanina pa lang nung nasa backstage tayo, parang ang dami na nating gustong ipa-prescribe.
grabe tanong. Yan. And I think ito yung first time ko palang maka-encounter ng someone na related sa medicinal cannabis and who is also a Filipino. So with in terms of like cannabis, 'di ba, parang medyo taboo pa rin siya sa pagdating sa culture natin. So hindi pa siya ganun ka-accepted. I think
Yeah,
we can ask our guest later.
yeah.
Ikaw Zel, anong tingin mo dun? May na-encounter ka na ba?
Siguro so it's more on sa hospital for chronic mga end of life stage patients. Pero again, it's something that we don't usually discuss.
Yes.
Um, it's very interesting actually to na ma-interview natin siya and to know more about it and for the first time sa maging part of our Pinoy Entrepreneurs Expo. So excited.
Yes. Without further ado, let's welcome Ryan Lloyd Semera.
Hello. Woo.
Hi,
Thank
Ryan.
you for having me.
Welcome.
Thank you
Salamat
so
sa
much. Hello,
time mo.
everyone. Good evening. 7:30. Good evening. Hello, Jen. Hello, Roselle, Ace. Hello. Good evening. Thank you for having me.
Thank you for coming, Ryan. Napaka-interested dito. Ang dami, 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 dami kung gusto itanong.
Sige, pag-usapan natin yan.
Yeah. So, firstly, introduce yourself muna. Where you're from, your background. Yeah, the floor is yours.
Okay, sige. So my name is Ryan Semera, owner and founder ng Core NP Health Clinic. It is a telehealth clinic, mainly a telehealth clinic, and we have few services offered, but mainly we are an alternative plant-based medicine clinic. But also, we also deal with chronic disease at saka yung mga general medical health consults. So if your GP is closed, or if your GP is away, or if your GP is fully booked, which is the case these days, you can call us if you need some specialist referrals. No, gusto nyong makita uli ang yung dermatologist or gynecologist, mga specialists, we can generate a referral for you.
Wow.
If you want, if you run out of tablets kasi close ang GP nyo, hindi kayo makakakuha ng repeat prescriptions, we can do that for you too. Kung nagkasikot kayo at hindi kayo makakatrabaho, wink wink, we can we can give you
I was
medical and
about to ask.
we can give you medical and sick certificate as well to support your illness na hindi na you're unfit to work on that day or for a few days. At saka
Mm,
yung general medical consult, unwell kayo, meron kayong infection or flu or something like that that you need to rest, we can support you. Whilst your GP is aware, you can't see your GP.
right. I'll put you on my speed dial. So,
At
Ryan,
saka weight loss. Weight loss is very common, is very popular these days. Ang dami, very common, daming choices. So sa mga tao diyan na gustong magbalik alindog,
yan.
we
Yes,
can support you. We can
present.
support you as well. Hindi naman kailangan eh.
The healthy way, 'di ba? Kasi we're
The
we're
healthy
still
way.
nurses, we're health professionals, so hindi naman yung aabusuhin natin yon. It's just to get
Correct.
us back to our normal healthy weight.
Correct.
Ayan. So,
And
so
and this
Ryan,
type of medication, Jen, this type of medication, especially weight loss, it has people taking weight loss medication needs to be monitored constantly and regularly. Kasi they need to give their body a rest before they can have a long-term treatment for weight loss. So it's good to be supervised and monitored and supported by a health professional para maging safe and healthy ang weight loss journey ng mga tao.
yes, at tamang-tama after ng December, January, tawagan na natin si Ryan para diyan. So Ryan, tell us about your background. So did you study sa Philippines or here? Tell us more
Yes,
about, yeah,
yes,
your
yes.
profession.
Yes, so I'm from Davao. Sa mga tanang Bisaya diya, hello sa inyo. Welcome, welcome. Daghang kong gipang-invite sa mo abot ra. So they'll be joining us later on. I've invited a few people. So I'm from Davao. I finished my bachelor's of science in nursing in Davao Doctors College to be exact. And then in 2007, we moved to Australia with my family.
Mm-hmm.
And obviously, as you know, Jen and Roselle, Australia won't recognize our qualifications at Philippines without. That time, I did a 3 months course at Deakin University, and then I got registered in Australia in 2010. 2010. And then after that, worked for agency, naging bank nurse at different hospitals. And then my first hospital job after ng registration ko sa Australia was at the Alfred AMU. And doon ko nakita, kasi I started specializing in diabetes eh. Doon ko
Mm-hmm.
nakita yung mga diabetes nurse educators. So pumupunta sila sa mga wards. And then I said, okay, ano kayang what kind of role, no, kasi they're independent at the same time they're educating people, especially the patients. Sabi ko, I want to do that. So in order for you to be a credentialed diabetes educator, you need to do an extra study. I did that, and then I did that for a few years. But then when I was doing it, parang may kulang pa din eh. It's not too holistic. Yung parang hindi mo ma-manage ang pasyente mo holistically. Kailangan mo pa silang i-refer sa GP kung back to their GP if you know na kailangan mo na mag-blood test o kailangan mo i-adjust ang insulin dose mo kasi it's too much for you kaya bumababa ang ang sugar levels mo. And I can't do it because I'm not authorized to do those things. And that ignited me to study further a master's degree in specifically for people who wants to become nurse practitioner. So I studied that and finished in year 2019.
Wow.
And yun, since then, I'm working as a nurse practitioner in a few areas and companies. And then just recently, I've decided maybe I'll have my own, and establish my own, and then just slowly, build it up, and hopefully it will become a little bit big sooner. But yeah, my background is I started really in diabetes, then branched out to wider chronic disease. And then nag-alcohol and drugs then ako for quite some time. I visit houses in the southeast area of Melbourne, and we provide home-based treatment for alcohol and drug affected people. Um, and then after that, men's sexual dysfunction ako for, for a telehealth company. So yung mga men's sexual dysfunction, like, am I allowed to say?
Yeah, yeah, of course. Erectile
Yeah,
dysfunction.
yeah, erectile dysfunction and premature ejaculation. I did that for probably almost 2 years through telehealth. Nag-start yan when the pandemic started. And
Mm-hmm.
then I discovered probably almost 2 years ago about medicinal cannabis, all alternative natural medicine. It became legal in Australia in 2016, so it's quite new.
Mm-hmm.
And so nagka-interest ako niyan because I'm into more natural based treatment than the conventional, yung mga prescribed medications, especially yung mga strong medications talaga.
Yeah.
And then yun, nagtuloy-tuloy na siya, and then until I've decided to establish my own.
That's amazing. I've never met a nurse practitioner na Pinoy. Kasi it requires a lot of hard
This
work, studies, grabe. So ilang years para maging nurse prac, Ryan?
So my criterias na hinahanap ang APRA or the health professional regulations dito sa Australia, you need to be functioning at an advanced level. Kung ano ang ibig sabihin niyan, napaka-wide niyan. So let's
Yeah.
just say if you're working as a registered nurse, let's just say you are grade 2 or grade 3, advanced practicing nurse, that means you are practicing way beyond the grade 2 or grade 3. So you need to provide it to APRA you're practicing at advanced level. You need to be practicing at least 5 years post-registration. 3 years of that 5 years must be in the specialty that you want to specialize in first.
Mm-hmm.
And then you have to have a mentor.
Mm.
either an experienced nurse practitioner or a doctor, a medical doctor, para mag-guide sa'yo in prescribing and interpreting x-rays and ultrasounds and all those stuff and diagnosing conditions. And then after that, you need to have at least 5,000 hours of advanced
Wow.
practice nursing hours na ma-provide mo to APRA. And then after that, they will assess your application. Master's degree, a specific master's degree in nurse practitioner, 2 to 3 years yan siya. But before that, you need to have at least a graduate certificate or graduate diploma in the specialty area na you're working in. And then master's degree for 2 to 3 years. And then submit mo yun lahat. And then APRA will assess and then endorse you after.
Napagod na ako. Hindi ako nag-ano, napagod na ako.
Pero grabe, parang that means from the start, you already know what you wanted to do.
Yeah.
Kaya parang focus ka and yung, alam mo, very streamlined na yung mga kinuha mo, yung experiences mo for that to be considered. No? So, grabe rin yung planning na ginawa mo for that.
Oh, yes, yes, yes. Kasi in not only that, because in order for the university to accept you and offer you a place to study, um, you need to, yeah, tama ka, you need to plan ahead because you need to tell them what area you want to specialize. Diyan ka
Yeah.
muna mag-start. Although pag nag-aaral ka na, you're not studying sa specific area. You're studying generally eh kung paano mag-prescribe safely, kung paano mag-order and interpret diagnostic tests, ganun. But you need to nominate as, specialty area. And obviously, yes, of course, you need to plan ahead because you need those 5 years and 3 years.
Yeah.
So, kung 5 years ka, tapos 2 years ka dito, then 1 year ka dyan, and then 1 year ka dyan. So, you can't prove to them that you have been practicing at an advanced level sa area na you want to specialize in.
I was just wondering, kasi alam ko, if you're working as a nurse practitioner, it's a good wage na rin, di ba? Because alam ko mataas na rin yung rate niyan. What pushed you to start your own business? If you're already
I
earning, if you're already a high income earner, what pushed you to start your business?
parang gusto, I, I want to be my own boss. Yung parang ganyan.
Yes.
Kasi I've worked with a few organizations in the past, both public and private, small and big companies. And when you want to have your own way of doing things, now you think
Mm.
that you can be more an effective clinician or person, then you can without going through the process. So
Mm.
the usual is consult mo muna ng manager mo will consult the director or whatever, and then the director will consult the CEO or the president of the company. So there's a lot of layers that you have to go through. So
Mhm.
pag ikaw, and then if you know that it will work and it can help and it will make you a better person and clinician, then why not do it yourself without having to go through the steps na
Yeah.
lalong patagal sa process. And yeah, I want to, it's very cliche, but I also want to help the community. Because I know myself as well. If I want to book a GP appointment, wala eh. This, they're fully booked in the next, 3 days, 2 days, or 1 week, sometimes 2 weeks pa. And I think because I had a chance to work for a telehealth company in the past. It's a GP telehealth company. And nakita ko they're filling in the gaps ng ating healthcare. So yung mga tao na hindi nakakapag-book to see their GPs just for a repeat prescription because they're running out of their diabetes medication, they're running out of their hypertension medications, hindi. So doon ko din na-realize, maybe I can do this one too, to help out. And
Mm.
the good thing is that now I know about, Pinoy entrepreneurs. Maybe I can promote it to my fellow Filipinos as well.
Yes, definitely. And
Mm,
maganda yung service na yun 'no, kasi 'di ba mawalan ka nung mga diabetic tablets, that's very important na
very
ma-replace
important.
kaagad kasi, it's life-threatening disease. So, kailangan
Mm,
talaga meron
mm.
kang supply palagi nun. So, it's good
Yep.
that you're
Yep.
bridging the gap kasi nga
And not all. Yeah. And not only,
Sorry.
sorry, Jen, not only that, because Eugene, you work in the mental health field. Is that correct? Yeah. You told me about that. Not only that, there's a lot of people as well who are, especially these days, especially during and after pandemic, they're a little bit down. But
Mhm,
especially dito sa Melbourne, na multiple lockdowns, nawalan ng trabaho, nawalan ng nawalan ng what's called that, work, nawalan ng
mhm,
income. Um, they call triple zero. They call their GPs because they are not 100% mentally.
mhm. Yeah.
And the good thing with telehealth is that they don't need to be physically in the clinic. They can be just in the comfort of their home, speaking to a health professionals who can make sure that they are safe and that they're heard of. Because marami talagang nasi-stress, marami nade-depress because of the pandemic and post-pandemic. And, you know, health consultation is not just about, oh, itong i-take mo para maging, maging maganda ang mood mo, para hindi ka maging depressed. It's about listening to them as well, kung ano
Mm.
ang dinaraanan nila. And by just listening to them and offering them support, that can actually boost their mood and their morale. So that is a good thing of telehealth as well.
Yeah. Is that bulk billed, Ryan?
It is bulk bills, most services, but when it comes to the ones that are more specialized, that are not government subsidized, especially the alternative medicine, it's not. It's not.
Okay.
It's The alternative medicine is really expensive.
Mm.
The products themselves, they are very expensive. Gonna tell
Yeah.
you that they're very
Yeah.
expensive.
Can you
There's
tell us
few.
like the price range, like
Yeah,
with
yeah.
this
So it
medicine?
depends upon the forms kasi when it comes to medicinal cannabis, may mga forms, merong tablets, merong capsules, merong oils, merong wafers, meron ding
Yeah.
flower. Ang flower is the form that people use to smoke or vape. Okay.
Yeah.
So depends
Mm,
upon the brand then, but the range is between 130 to sometimes 300 something. And
Yeah.
when I
that's
say
for a month.
100, depende. So when it comes to flower, we call it dry herb. Yun yung sinusunog ng mga tao para mag-smoke sila ng
Mm,
cannabis, ng medicinal marijuana. That's only for 10 grams. That's only for 10 grams. And for people who's, let's just say, they have anxiety and depression na matagal na, long standing, tapos
mm.
konting trigger lang, tumataas na agad ang anxiety levels nila, 1 gram is not enough. Sometimes they need to take 2 grams. So imagine 10 grams, and then they're using 2 grams a day. That will only last for 5 days, and that's 200 for every 5 days. So it's really, plus they pay the consultation fee as well. And sometimes like the range ng, sometimes other doctors, they're asking 200 to 250 per
Oh.
consult.
So
Yeah,
what's the difference between the normal marijuana and the medicinal flower na dry herb?
yeah. Okay, so we call it off street or black market marijuana. The difference is, black market or off street marijuana, they are illegal.
Mhm,
Medicinal cannabis or medicinal marijuana, because you have prescription and you are supervised by a health practitioner, it's legal and it's more safe. Okay.
Yeah.
And the other difference is black market marijuana or off street marijuana, you don't know what actually is in it.
It,
Okay, you could say, oh, this is marijuana, it helps with my pain, but what is actually in it? Anong meron dyan? Kasi we have strains eh. We have strains. Meron tayong marijuana that will help you make sleep or comfortable. And you're correct, kanina, Rosel, it's used sa palliative patients. For cancer as well, cancer pain. Meron tayong different strains. Meron din tayong strains ng marijuana that will make people more stimulated, more
mm,
productive, you know? So we don't know what's in the black market marijuana. Sa medicinal cannabis naman, we know because it's manufactured. And we
mm,
also know how many grams of this and how many grams of that na ingredients ng medicinal cannabis.
mm,
And it's heavily regulated. Sa mga tao
yeah.
na gustong mag-prescribe ng medicinal cannabis, you actually need to ask for a medicinal cannabis use permit through the government before ka makapag-start. So, hindi lang yan basta-basta na you go to your doctor and ask, oh, I've been taking these opioids, endone, yung mga strong painkillers, oxycontin, pentadol, mga ganyan. It's not working for me or not enough. Can I try alternative medicine, medicinal cannabis? Can you give me? It's not just like that. I mean, the doctor can give you, but then the next step there is you need to apply for a permit, and will the government, you know, give you that permit for you to start using medicinal cannabis, because your
Ah,
doctor needs to clinically justify that you really need it. And once that you satisfy the government, yes, you need it, you've tried it, it's not working, then the government then give you the permit to start using medicinal cannabis. So it's heavily regulated, but it
Yeah.
works.
hmm.
Can you just give an example, siguro, no, for our viewers, no, na parang when would they, because sometimes siguro the GPs would not openly just discuss this. Parang who would be the main patients na makikita who would benefit to probably medicinal cannabis. So you've mentioned about, yung na nga, ano, yung mga may anxiety or those who are
Mm,
in palliative. Anyone
mm,
else in the
mm.
community?
Yes. So the thing with medicinal cannabis, it's experts nag, they're still discovering new what you call that, new properties of medicinal cannabis, that for this medication, for this. Before, they said it can't be used for people with fibromyalgia, pero ngayon it can be used with, for people with fibromyalgia. There are some contraindications though. So this medicinal cannabis is contraindicated for people who are already abusing other substances such as
Hmm.
heroin, cocaine, and other substances. They are they it it's People who's got heart diseases are not eligible. People who's got liver diseases are not eligible.
Wow.
Um, then it's not eligible for people under the age of 17 years old unless they have a clearance from their pediatrician.
Hmm.
It's not for people who's diagnosed of psychosis. That's a severe form of mental health illness, because there's a potential it can cause psychosis, or it can, yeah, baka lalong lumala ang psychosis nila, unless they can obtain a psychiatrist clearance that they are okay to use it. And yes, a lot of doctors out there, they still have that stigma.
Yeah.
They're not too open-minded when it comes to alternative medicine. Hindi lang mga doctors, but mga tao din. Kasi pag
Mm-hmm.
narinig nila ang word na marijuana, parang natatakot sila, oh, it's marijuana, it's illegal drugs. So ganyan din, nahihirapan din ang mga tao na into alternative medicine because of that stigma. And not only that, for those people who are already using it, parang natatakot sila na to use it out in the public because of the judgment na natatanggap nila. But it's for a lot of conditions. Mental health aspect, ang common talaga is anxiety and depression and PTSD. Napaka-common. Probably 90 to 95% na tumatawag, I need this, because they've already tried anti-anxiety, antidepressant medications, hindi nag-work, or nag-develop sila ng side effects. And once they've started the medicinal cannabis, it's actually working for them. And ang nangyayari is they start to reduce their dose of their anti-anxiety and antidepressants until they're not using it anymore, because ang medicinal cannabis nag-take over sa kanilang treatment. Any pain related, it's very common. Yung, broken hips, any pain after motor vehicular accident, nagka-sustain sila ng ongoing pain or long-term pain. Yan, ay common indication din yan. Insomnia, sleep disorder, napaka-common din yan. So, yun ang mga common indications, common conditions na nakukuha ko from those people who wants to access medicinal cannabis. Yeah, but
Hmm.
yeah, because it's very heavily regulated medication or treatment, you need to screen them, because a lot of people do clinic shop or pharmacy shop. They shop around. So they go from one prescriber, from one doctor to the other, because they want to use more. So instead of using it medicinally, they're actually using it recreationally, because they addicted na sila sa high volumes of marijuana. It's a little bit tricky industry.
Yes, yeah.
Mm,
Very interesting talaga na sabi mo, you're very passionate about these alternative medicines. What, triggered your curiosity dito sa alternative medicines na 'to? Kasi being in a nursing background 'no, parang mas more on talagang mainstream medicines tayo, like especially
oo.
when trained back in the Philippines. So, saan paano nag-start yung pagiging curious mo dito sa alternative medicines?
So when I started working for alcohol and drugs, okay, and
Mhm,
then providing treatments home-based, pumupunta sa mga sa mga bahay-bahay ng tao at nagbibigay ng home-based treatment and then link them with an alcohol and drug counselor for the counseling. Doon ko na nakita kung gaano kaapektado ang mga taong ito when it comes to illegal drugs.
mhm,
And then they start, yeah, so yung people who are taking, heroin, cocaine, opioids, and then they start opioid replacement therapy. And then meron din yung sa marijuana.
mhm,
They are abusing it because um, no one is supervising them. No one is monitoring them. Okay. And just for the information of everyone, marijuana is actually one, if not the most ancient medication that we have on earth. It's just labeled as illegal drugs because ang mga tao is using it incorrectly and they abuse it. But if you
right.
use it just the exact amount with the supervision of a health practitioner, it is a very effective medication. So nung nalaman ko, oh, okay, there's a lot of people affected, not just heroin and cocaine, not just alcohol or benzo addiction or opioid addiction, meron ding marijuana. And then when it became legal in Australia in 2016, sabi ko, okay, why not convince these people who are addicted to marijuana to swap into medicinal marijuana instead of black market marijuana para
Mhm,
maging safe yung kanilang consumption ng marijuana, and it will be more effective because we know the ingredients of that product instead of the black market wherein the ingredients are unknown. So do not, and it works. It
mhm.
works. Maybe some hindi for them because probably the level of the stage of the condition, okay,
Yeah,
especially let's just say cancer. Okay, so cancer mostly yung nausea and vomiting and the pain. Yun yung
yeah.
main indication ng marijuana. But because the more that the cancer will progress, the more na lumalala din yung symptom. So I would say 90 to 95% it works for people. And doon ko nakikita, oh, marami pa ang ganda pala ng benefit ng medicinal cannabis. And it's a good way as well it's a good way as well to tell people through those successful treatment ng ibang tao na it can work. It can work. Para
Yeah.
mawala yung stigma, why not consider alternative medicine? Why not consider medicinal marijuana? Maybe this is the answer. Maybe this
Mhm.
is the answer. And maybe this can help with the symptoms na, iniinda mo na for how many years?
Yeah.
You've tried a lot already. Nothing
Mhm.
works. You've seen specialists already. You've spent hundreds and hundreds of dollars already to see these people, to buy this medication, pero nothing works. Why not try this? It's not cheap as well, but then why
Mhm.
not try this one? Maybe it can make miracles, and maybe this is your treatment and not the conventional medicines that we have out there.
Yeah. Yeah, yun lang talaga ang kulang with these new alternative medicines is ano talaga, information and education sa tao. So, it's good that, yeah, it's good we're having this, interview today para mas nakaka-educate tayo.
Yeah,
And mas
it's
maging
good that
open tayo, 'di ba?
yeah, it's good to have an open mind, and I'm not too sure. I know you mentioned it before sa backstage. I'm not too sure with our countrymen, Filipinos, kung gaano
Yes.
sila ka-open mind about this. Because you know us,
Mhm.
we're very conservative people, not just about other things, but also when it comes to treatment. Siguro the moment that they will hear marijuana, probably they'll say, "Oh, I'll stay away from that because
Yeah.
that is illegal drug."
Adik yan.
Oo, adik yan. Nagma-marijuana yan. Ba't ka lumalapit sa taong yan?
Sorry, Sel,
Yeah,
nag-hang siya. Oh,
naghang
yun
siya.
nga 'di
So
ba
yeah,
parang yun nga sobrang conservative nga, parang yun male-label ka na kaagad na stereotype
yeah.
na adik na
Yeah,
agad.
And that's why I'm thankful nga na ano ko 'tong expo this coming March 2 kasi alam ko maraming tao a-attend, and I will take that opportunity to actually educate them. Not just to
Yeah.
promote my business, which is good for me, but also to promote na may something pa there. Especially doon sa mga taong nawawalan na ng pag-asa. Ang dami nila,
Hmm,
you don't believe it, ang dami nila nawawalan na ng pag-asa kasi wala ng ibang makikitang treatment na makakatulong sa kanila.
yeah.
And most of them when they started, wow, the effect very
Mhm.
positive. And it's a good way as well to to wipe that stigma kasi
Yes.
uh, it's 2024, and I think we need to be open mind and consider other treatments na makakatulong.
Mhm. I think especially with chronic pain 'no, ang dami kong being in a mental health background, ang dami kong
Mm,
patients na hindi mo alam kung ano talaga yung nauna, yung depression ba o yung pain. Kasi hindi na nila ma-manage yung pain. So, nade-depress na sila, na-impede na yung, activities of daily living nila. Hindi nila magagawa yung mga, yung mga things that give them joy. So,
mm.
tapos yung mga medications, hindi na rin nag-e-effect sa kanila. So, it will be a really good, alternative treatment.
Yeah. And yung
Yep.
mga iba ko nga na mga na-encounter, no, for those who are in chronic pain or in pain, no, parang minsan tinatanggap na lang nila na parang, well, because this is
Mm.
like, my GP told me na wala na magagawa. So, it's good to know that there are other alternatives so that you can still have a good life.
Mhm.
Yep. Yep, yep, and it's safe. So according to the study, the risk of being addicted to medicinal cannabis is very low, and the
Mhm.
risk of over what you call that? Oh my God, nakalimutan ko ang term. Yung parang na-over ka na, overdose, over yung
Overdose.
dose. Overdose is very low. Bakit? Because it's
Right.
medical cannabis. It's you are being supervised, you're monitored. The dose is supervised, is monitored. The dose is it kung kasi it's like what I told you before earlier, it's monitored by the government as well eh. So kung
Mhm.
yung prescriber mo said you can only have let's just say kung cannabis oil, you can only have a maximum of 1 ml a day. 'Pag lumagpas ka diyan malalaman ng gobyerno. So there's a high chance na ika-cancel mo yung ika-cancel nila yung medicinal cannabis permit mo. You can't
Mhm.
access medicinal cannabis anymore. So I always tell them you need to stick to the limits, otherwise no more medicinal cannabis for you. And they understand that. So that's why there's lower risk of overdose and lower risk of addiction.
Hmm, that's very interesting. May mga nag-message sa'tin, Ryan, si Erica, naghe-hello siya, "Hi everyone."
Shout out, shout out.
And Soy Soy
Um,
Tinggal,
Soy
is this
Soy,
your
yan, nasa Pilipinas yan, nurse din yan. Friend ko yan.
understand? How to
Friend ko
avail
yan.
the weight
Shout
loss
out.
how to avail weight loss tablet. Ayan, malayo pa pero malayo na. Congratulations. Yes. Still you look young looking. O, 'di ba for 40,
Sure.
over 40. Um, from May May Taylor. Is this your friend?
Yes. No, that's my mom's friend. Oh, yun nag-invite din ng mom ko.
Aw, so nice. Eh, may
Ah,
tanong siya, would you consider medicinal marijuana affordable than the science-based medicine?
hindi din eh. I mean, would you consider? Again, depende sa brand at saka depende din sa amount. Okay, so let's say yung maximum level na maximum dose na you can have will make the flower as an example. If your maximum that if the maximum flour that you can have is 2 grams a day, so and then your product is let's just say 250 per 10 grams. Pag mauubos mo yan within 4 or 5 days, then that's another new script. That's another new $250. So it really depends upon how much you can have, kung ano ang brand. If I compare the flour base to oil base, mas cost effective ang oil base. Why? Because you only need that much. You only need few mils, few drops under your tongue. So
Mhm.
and most of the time ang bottle ang marijuana bottle na dinidispense ng pharmacy is 30 mils. Okay. And if your, let's just say if your maximum daily dose is 1 meal, even 2 meals a day, that will last you for probably 1 to 2 months. So that's
Mhm.
very cost effective. But if you're going to ask me which one is more um, quick acting, kung naghahanap ka ng, quick relief sa symptom mo, it's always the flower that you smoke.
Mhm.
Kasi it goes straight to your lungs and go to your circulation, starts to work. Then as compared to, let's just say, tablet, punta pa sa stomach mo, digestion pa,
Mm.
uh, there's no assurance that all of it will go back to your circulation. Maybe pupunta yan diretso sa feces. hindi babalik sa circulation, hindi rin magiging effective.
Ah. And then she got another question. Pain management ang main benefit ng medicinal marijuana?
Madami. Actually, madami talaga. It can be used for, like what I said earlier, weight loss. It has weight loss property. It has anti-inflammatory property. Um, ang madami siya.
Ayan. Zel, may question?
Wala pa naman. Pero I could really see no na talagang ang dami niyang benefits if talagang tatanggalin lang natin yung ano,
Stigma.
yung mga stigma, oo.
Yeah. It is very promising. It's still, if I compare Australia to, let's just say, Europe, US, Canada, or even Thailand na legal na, grabe
Mhm.
talaga. Even sa mga convenience store, nandun,
Oh
nasa
my
stante,
gosh!
kuha ka lang, bili ka na agad, makukuha mo na. Sa US naman, each house they're allowed to plant two plants of cannabis na may permit.
Talaga?
Yes, sa Europe naman, especially Netherlands, there it's kahit saan ka tumingin, nandun ang cannabis. So we're a little bit behind, and to
Mhm.
tell you honestly, I kind of like that because at least nakokontrol mo,
Mhm.
as opposed to, let's just say, Thailand na grabe readily available sa mga convenience store nila. Kuha ka lang tapos bayad. Sinong
Mhm.
magmo-monitor, di ba? Um, but yeah, yun nga lang, yung stigma nga lang talaga, and we have to be open mind talaga for, other treatment.
Mhm.
But I think we're getting there. I think we're getting there. Just few more, you know, education to people about it. I think we'll get there slowly.
And Ryan, tell us more about your business. Napakabago nito na nurse-led like clinic. Wala pa talaga ako na-encounter.
Yeah.
So, tell us more, mahirap ba siyang i-start? Pero bago diyan, i-welcome muna natin Audie, my husband. Yan,
Oh, hello.
Hi
nakapihon.
everyone. Sorry, late. Yeah.
Hello.
Hello. Nice to meet you.
Nice to meet you too.
Ayun. So, yeah, tell us, how did you set it up? Mahirap ba yung process? Yeah, para ma-inspire yung mga nurses natin diyan na you can also be your own boss.
Yes. For me, hindi siya gano'n kahirap kasi I already have an experience working in the telehealth industry. I guess kung anong mahirap is saan banda is, especially yung nagsa-start ka pa, you are it, eh. Ikaw lahat. Ikaw nag-organize ng yung calendar of appointments, ikaw ang nagfa-follow up ng pasyente mo after a few days or few weeks. Ikaw ang sumasagot ng mga telephone inquiries, ikaw ang nagpo-promote sa business mo, ikaw ang nagha-handle ng invoice, ng taxes mo. Yun ang mahirap 'pag nagsa-start ka, eh. Kasi obviously, yes, as a startup, you need to, what you call that, kailangan mo ding i-lessen yung expenses mo. So wala ka pang, ang tawag diyan, wala ka pang help. But
Yeah.
once you establish your business, yun na, eh, basta may tiyaga lang talaga, um, yun na, eh. At saka, for those people who want to start their business, especially the nurses out there, that we are very talented, skillful, and highly educated people. You just need to believe in yourself. Okay, ang dami nating magagawa, and we need to realize that na marami tayong magagawa, marami tayong maitulong sa tao. Hindi lang dapat hindi tayo nagti-think na it should be a doctor-based, medical doctor-based service kasi doctors can do a lot. Ang daming businesses na gusto na pwedeng mai-open ng isang nurse eh.
Mhm.
So and especially if you want to if you're planning to open your own business, you need to start now kasi kailangan mong makakuha ng slice ng market. So if you will start late, wala ka ng slice ng cake na makukuha kasi nakuha na nila. So if you want to start now, although it's very, it can be difficult to start with, but once you've already started, alam mo na kung ano ang galawan ng business, then then you will start gaining benefits. So and ask around sa mga fellow entrepreneurs. Andito sila oh. Mga experts, yan oh.
We were learning so
Kung
much too kasi nga this is very new. Like we're
Mm.
ah,
new nurses and we didn't even know na ano. You
Kasi
can
ah,
parang asking, parang ano ba pwedeng business ng nurse? Because physio can have their own practice,
yes,
OT can
yes.
this, and then parang nurse ano nga, no? But then you've opened some doors there.
Yeah, yeah. And there's a lot of few things that nurses can do, such as alam ko, and nurses don't need to be nurse practitioners. Alam ko, there's a lot of nurses who open their wound clinic. Kasi we as nurses, inaalsa ko yung bangko natin na, we as nurses, we are wound experts. A lot of nurses visits nursing homes and accept referrals from nursing homes. They go
ah,
and visit and do wound consults. A lot of people became educators as well. So they go to a lot of businesses as well to conduct businesses. A lot of nurses are immunizers, especially during flu season.
yes.
Tumatanggap sila ng referrals to go to corporates and nagbibigay sila ng flu vaccinations. Marami talaga, marami.
Mhm.
And then when it comes to support, and like what I said, that you just need to ask around because ang daming support na makukuha.
Yeah, ang daming ma-inspire niyan 'no, kasi hindi lang siya hospital-based. Kasi 'pag sinabing nurse usually naiisip lang, shift work at a hospital, ganyan na ano,
Mm.
um, ah, ang hirap din minsan yun lalo sa mga, nurses with families, with young kids, ang hirap ng shift work, 'di ba, Sel?
Yeah, yeah.
So, eto na, mag-isip na tayo ng ano.
Exactly. And if you want to broaden your service para mas maraming service ang may offer mo, kung may time at kung may time pa, you can study short courses or even post-grad courses para to support your expertise. So let's just say if you want to specialize in diabetes, you can study a grad certificate in diabetes. Then you become a diabetes educator. Then you can accept referrals from anyone. And Australia is a diabetes country. Ang daming taong may diabetes dito, so you won't run out of work and
Hmm,
referrals. So yeah, so um, open your business as soon as you can. Although after gathering the information na para makapag-open ka ng successfully. And then my advice is if you have time to educate yourself more, then do it because it is something that you can back yourself up. So if you want to practice in a specialty and then a lot of people will say, oh, why are you how why do we have to trust you? And then you can easily tell them I actually have this qualification and skills and I can do the task.
that's very good. Ang ano, nakaka-inspire talaga 'yun. Gusto ko rin 'yan, maging be my own boss. Kasi ang sarap nung, parang minsan secondary na lang din 'yun, eh, mas nakakatulong ka, 'di ba, 'yun nga, like what we said earlier, you're bridging the gap. And, yung mga clients mo, tell us about it, ilang percentage, marami ka na bang Filipino clients na natatap sa market or is mostly locals?
Sana after this marami.
Dalawa na dito.
Like, it's scary.
Wala, zero.
Wow!
Yeah. Sa previous telehealth clinic na telehealth companies, may mga probably dalawa, tatlo, pero dito so far wala. Wala. So
Okay.
hopefully soon after nito.
Yeah. Is it because of the area where you're at? Kasi Pakenham, hindi pa masyado ata maraming Filipinos.
Wala masyado. Wala masyado. Mm. Wala masyado. And because when I open it, hindi ko pa siya masyadong na-promote.
Mhm.
Na-promote ko siya through yung mga med reps, mga clinics, mga nursing homes. Yun, hindi masyadong parang ganito na parang ima-market ko talaga siya out there
Mhm.
sa community. Yeah. And this is actually my first expo. So hopefully marami after.
Yeah, definitely.
And that's my aim as well for Filipinos to realize this service as well. So
Mhm.
hopefully makapagbigay ako ng enlightenment sa kanila come Expo Day on March the
Mm.
2nd
Yeah.
about it. Hopefully pag nabasa nila ang alternative medicine, especially medicinal cannabis, hindi sila hindi
Mhm.
sila matatakot. In fact, hopefully they will approach me and talk more about it.
Yes. Boys, may mga tanong ba tayo? Tahimik tayo dyan.
Marami.
Ayan, daw.
Ace?
Um, so, going back doon, kasi, di ba, I'm listening earlier, naging passive lang ako. So, medicinal cannabis regulated, and it's good regulated kasi sa black market, you don't know ano yung components nun. And then, while other countries na very progressive, and tayo sa Australia nga, hindi pa ganun, hindi sa Philippines din. So, all of those things attributed sa nagiging yung stigma ng cannabis, di ba? So, so yung question ko doon is, kung bakit siya ni-regulate or regulated pa rin siya at the moment while it's also legal. And then, second thing then, yung sa black market, anong ginagawa nila na different sa regulated? And then, meron ba siyang addictive component kaya nire-regulate siya?
Okay, yeah, very good question. Very good question. So one of the reasons why it's regulated, in fact, I forgot to mention this. So there's two most abundant component of a marijuana plant. Okay, there's hundreds. Okay, pero ang dalawang ito is most abundant. Kaya sila ang ginagamit as medicinal cannabis product. We have CBD and THC. Okay, the CBD is okay. CBD is okay. But the THC component of a cannabis plant is the one that will potentially magkukos ng psychoactive effect. Yung parang nag-take ka talaga ng illegal drugs na you feel high, you know, there's a high chance that magiging dizzy ka, magiging drowsy, magiging sleepy. Okay, that's why it's very highly regulated because they want people accessing medicinal cannabis to only use the required dose. Because my potential, especially those people who's used black market cannabis in the past, they might use it for recreational purposes and not for medicinal purposes. So the Therapeutic Goods Administration ng Australia, sila ang nag-release ng mga guidelines. And currently there's a maximum dose per month or per day that a person can only have. So, and that's why it's highly regulated because they want to make sure that those people hindi sila mag-go beyond what is, what is the maximum. And that's the reason why and the other thing is because of the psychoactive effect. Okay. There is driving regulations surrounding to it too.
Yeah,
Because
I
of
was
that,
about
there
to say, like
no
benzos.
driving.
Yeah.
Yes, no driving after using any THC. CBD is okay as long as it's isolate. We have this term isolate. Pag sinabing isolate, CBD lang talaga yan. Kasi meron din mga CBD na product na medicinal cannabis na merong small traces of THC. At
Mhm.
kung nag-drive ka after use, kung merong pulis sa likuran mo, randomly stop you for a drug test at nakita sa report na merong THC, wala na. Wala ka
Ah,
na. Hindi ka na makakatakbo.
kahit
Even
na
even if
prescribe.
yes, even if you will tell them it's for medicinal purposes, meron akong prescription dito or meron akong medical certificate dito na nag-support na I need this, they won't gonna let you go. Unfortunately, in Australia, wala pa. Although there are talks now. Kasi if you take
Gano'ng
Valium,
katagal yun?
if you take opioids, pwede ka eh. Even with alcohol, as long as ganyan lang ang level, pwede kang mag-drive. Pero with marijuana, wala talaga, zero. Zero. So
For
that's
how
why
long na
that's
yun?
okay, that's a good question too. Yan ang tinatanong ko ng mga pasyente about that all the time. There is no definite answer to there's no definite answer to that because it's dependent on how quickly your body can eliminate THC. Okay, kasi your body is different from anybody out there. Eh. So it depends upon how your kidney is functioning. It depends how your liver is processing the medicinal cannabis. So my advice to them is especially for people who's using medicinal cannabis for insomnia, for sleep disturbance, is to take it early in the evening or late afternoon para to give their body a more time and chance to process and be eliminated the next morning. Isa pang advice ko is mag-drug test the next morning before hitting the road. Kasi meron tayong drug test kit na mabibili sa local pharmacy, just like COVID rat test. So
Yep.
it's a saliva test. You can test yourself in the morning to make sure walang THC before ka mag-drive. Kasi you don't want to take that risk. You want to be safe out there, but also you want to make sure that other drivers are safe as well para yeah.
Yeah.
So yun.
Yung follow up lang, yung THC ba yun?
Mm.
Some distant future, pwede ba siya mag-engage na katulad do alcohol 0.05 or ito magiging 0.02
Yes.
and then you
Yes.
can use
There are talks na babaguhin nila yan kasi ang daming nag-argue, bakit they're still allowed? Bakit ang mga tao, they're allowed to drive? Na basta nandyan within the limits lang yung alcohol levels na. Bakit ang taong yan taking opioids like endone or methadone, bakit they're allowed to drive? This person is taking Valium. Why are they allowed to drive?
correct.
Bakit ako na medicinal cannabis, I'm not allowed to drive? So a few weeks ago, ang nabalitaan ko is the government, they're in talks to change that. Pero as to when would that happen, I have no idea. I have no idea at the moment. Yeah, because I think it's legal. Yeah, that's correct. That's correct. No, it's contradicting. It's legal, but then there's still a lot of regulations surrounding to it. No, um, I think ang government natin mismo meron pa ding a little bit of stigma when it comes to cannabis use. They allow people to use cannabis. They allow people to use marijuana for medical purposes. Pero mayroon pa rin silang stigma. I think they're still not sure kung anong gagawin from here, kung anong magiging future. But I think we will go there. Kasi like what I said, if we compare Australia to other countries like the US or Europe, napaka behind natin. Very behind. Pero we are slowly getting there. In fact, a few months ago, they allow just the CBD tablets to be displayed sa mga pharmacy shelves. So it is now a pharmacy only medication. Only CBD walang THC. So pwede kang pumunta doon at tanungin mo ang pharmacist, can I have CBD tablets? And then they ask you a few questions, and then if you're eligible, then they can give you some CBD tablets.
Doesn't need to be
Mm.
prescribed.
It is now a pharmacy only.
Ryan,
So that means hindi mo siya makukuha sa shelf, kailangan mong makipag-usap muna sa pharmacy.
Mhm. Sorry, Ace.
yun lang sa mga hindi non-medical background, ano yung TBC and CBD? Ang tingin ko doon parang kala ko CBD eh.
CBD, they're chemical compounds na nakikita sa marijuana plant. Ine-extract nila yon and ginagamit nila yon to make a medicinal cannabis product. And mga product natin ngayon, they are their CBD alone, meron ding THC alone, and meron ding combined CBD and THC.
So, compound
But
siya.
ito ang dalawang sagana, mas sagana sila sa isang cannabis plant. Mas maraming CBD and THC, although meron pang maliliit na mga chemical compounds, but these two are the most common and abundant. That's why they're being used commonly.
Ang dami nating natutunan today. Sorry, Ace.
Any other applications ng medicinal cannabis aside from mental health, illness, or pain, or chronic illnesses?
Pampapayat daw.
Ayun.
Weight loss. It has weight loss properties. Nausea and vomiting. So those people with
appetite mo?
What's that?
Tinatanggal niya yung appetite mo kumain?
Parang ganyan, parang sinusuppress niya. Parang according to the study, parang ang cannabis, it will signal your brain to tell your stomach na puno na ako, don't eat. Don't eat more kasi puno na ako. So yeah, mas konti lang kakainin mo. Parang
So,
yun yung studies na na-find out na.
Makes sense yung mga rockers na payat nagte-take talaga.
Well, hindi ko sinabi yan.
Anyway, that's a
May gusto lang bumati kay Ryan, Rosella Becerra.
Wow, from Digos.
Digos City.
Digos, there you go. Digos. Speaking of Digos, shout out, Rosella.
May tanong ulit si Soy Soy. Kahit walang nararamdaman, would you recommend it to people?
Hindi eh. My eligibility criteria eh. And like what I mentioned earlier, before a person can start using medicinal cannabis, there is that person needs to have medicinal cannabis permit to start using. And as myself is the one doing it on my patient's behalf, and I need to clinically justify why they need to start using medicinal cannabis. If I can't justify it because walang indications, walang conditions, then I'll be in trouble. I'll be in trouble.
Di pwedeng may party lang.
They will start questioning. They will start questioning, but bakit ka nag-prescribe ng cannabis nang wala palang indication? So they will use it recreationally and not for medicinal purposes.
And you lose your license too.
Exactly.
Yeah.
Exactly.
And
so far pa naman, dalawa pa lang ang na turn down ko. One is na-prove ko na he is using it recreationally. Kasi na-trace ko na he's accessed another prescriber and he was dispensed of multiple cannabis products 3 days before the consult. Kasi merong government platform na we can access kung ano ang na-prescribe and ano ang na-dispense sa isang tao, especially scheduled medicines. And doon na-trace ko. Pag sabi ko sa kanya, oh no, I asked him, have you used medicinal cannabis in the past? He said, oh no, this is the first time. So I went to this platform, this website, and then I found out, you've been, and I said, you've been, no, you're not telling the truth. You've been dispensed 3 medicinal cannabis products in the last 3 days. Naghang up siya. Kasi nahuli ko siya. So there's a lot of eligibility criteria because you can't just prescribe it without indications. Otherwise you'll be in trouble.
Yes. And follow-up question, does it have any adverse effects aside from being high?
Yes, so generally medicinal cannabis can cause sedation, okay? Because that's the primary aim. It will provide you comfort and relaxation. So if you're already taking medications that are sedating, such as benzodiazepines, sleeping pills, you need to tell your doctor or your prescriber about it because ayaw mo ma-sedate further. Otherwise, mag-take ka ng temazepam mo or diazepam mo na high doses, and then on top of that, mag-take ka pa ng medicinal cannabis. Baka hindi ka na
Hindi ka
baka hindi ka na makagising kinabukasan kasi
Talaga.
you're
May mga
heavily sedated.
contraindication
Mm.
sa ibang medication din.
There is, yeah, you have to be careful. Yeah, they have to be careful. Yeah, because
that's
it's
good
sedating. Cannabis is sedating.
under supervised by a specialist, di ba? By someone like you.
Yeah,
Stress ako,
and
Ryan. Pwede ba ako ng prescription? Kailangan ma-relax. Hindi pwedeng gano'n.
hindi pwedeng
Hindi
ganon.
pwede.
Give me
Marami ako nainom
more
kape. Gusto
information.
ko matulog.
Yan. But you know what? Ang daming wise na tao eh. Ang daming wise na tao because they know that there has to be at least one indication. So they already know what to say to you eh.
Okay.
Mhm.
Yeah.
Kahit hindi true, kahit hindi legit na indication, they will just tell you na I have this condition. Pero malalaman mo rin yan eh. Especially pag may experience ka na, malalaman mo na the more that you will ask questions, more questions. Kasi you're not doing it for yourself, you're doing it for them to be safe. And
Yeah.
if they're not cooperating, you can be upfront to them. Now I want you to be safe, and myself as well as your health practitioner to be safe. Can you give me more information? If you can't give me more information, can you give me your GP's name, and I can ask for your health summary para ma-sure na hindi siya nagsisinungaling.
Mhm. So, very strict talaga, which is really good kasi nga ang daming like with me working for mental health, ang daming addicted na
Mm,
tao.
mm,
Like,
mm,
parang lately wala na akong nakikita na purely mental health lang, almost dual diagnosis with drug and
mm.
alcohol.
It's harder to
Yeah.
manage.
Yeah, it's really hard. Any more questions, boys?
Medyo
I'm good.
Thank you. But yeah, just ulitin ko, hindi, the clinic, the telehealth clinic is not just mainly for alternative medicine or plant-based medicine or medicinal marijuana, but other services as well that we
General.
can offer. Yeah, especially if you can't get hold of your GP ng doktor mo because they're fully booked. They're on leave. And then if you require urgent repeat prescriptions kasi you're running out of your losartan, losartan. Napag-common sa Pilipinas ng losartan, ano? You're running out of your diabetes medication
Metformin.
kasi yeah. Then we can provide that to you as well. There are conditions as well. One of the conditions is as long as you've seen your GP within the last 3 to 6 months. We can't just give you repeat prescriptions if you've seen your GP 1 year or 2 years ago, because how can we make sure that your medication is still current?
That's right.
We also don't provide long-term scheduled medications such as Valium and Endons and all those stuff, only for urgent cases.
Right.
If you are sick and you can't go to your and you can't work because you are sick, we can give you some sick and medical certificates as well. Kung gusto nyo makita yung specialista and gusto nyo ng renewal ng specialist referral and you can't get it from your GP because they're fully booked, we can give that one to you too.
Nice. And yung scripts, Ryan, so do you send it directly to the pharmacy? Because other GP services does that. Or nagsisend ka ba ng QR code?
Yes. So it's e-scripting. So from the medical software, doon ma-generate ang script, and then isang click lang, it's either ma-send yun directly to the patient's nominated pharmacy or to the patient themselves.
Okay, that's very good. So, mas mababawasan na yung queuing sa GP. Di ba?
Correct.
Hopefully, and yeah.
And not only that, Jen, because a lot of people would go to emergency for minor illnesses because
No,
they can't
yes,
see their
that's
GP. So
right.
it's really a big an alternative, an option for people.
And do you fully bulk bill?
Mixed billing,
Mm-hmm.
mixed billing.
Okay.
So people who's got concession cards, pensioners, they are bulk billed.
Okay, right. And sa mga private patients, how much is the charge usually to consult with you?
It's only
Or it
I think it's only
varies?
yeah, I think it's only 30 or $20.
Okay.
Mm.
So sa mga magpapa-prescribe din ng weight loss. Medications, ayan, may mga nagtatanong kanina paano daw magpa-prescribe, we just contact Core NP Health Clinic.
Yes, 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 yes,
Ayan, and
yes.
Ryan paki-invite naman sila sa expo, ito na tayo, lalagay ko na dito sa
Yes, very,
stage.
very excited, guys. This will be my first time to join the expo. Although I was there last year, I visited Diana's stall last year.
Ah,
Anyway, um, guys, please support. Come and join us and celebrate with us this coming March 2nd from 9 a.m. Yan, ano? Yeah, 9
yes,
a.m. 9 a.m. to 7 p.m.
6 PM.
At 6 p.m. Bunjil Place in Warren. Opposite lang yan ng Fountain Gate. Para maging easy sa inyo. So
Mhm.
please join us. March 2nd from 9 a.m. to 6 p.m. Yan, maraming mga stalls there. Maraming Filipino businesses there. So please check them out and please visit my stall as well on March 2nd sa Banja Place, Narwarren.
Yan, and may mga pa-freebie si Ryan, not medicinal cannabis, but what are you giving away?
Not medicinal cannabis, because first of all, it's not allowed. It's not allowed. Second, very expensive to give out to give out samples. um, so maybe what I can offer is probably discounted consultation fees. Okay.
Wow.
May kasama ako on that day to help me educate people about medicinal cannabis and other products that we can offer. But yeah, my freebies ako, especially for those people na may diabetes or may kakilala na may diabetes, I'll give out glucometer or sugar machines for free. Okay. Um, so just approach me and I can give them to you.
That's very nice. Ace, final word summary?
Ano ba? So, very unique business. And I think ikaw, so far sa sphere of influence namin, ikaw pa lang yung nakita namin ganitong business. So, uh, I think you know the field. It will be big one day. I think
Yeah.
it's growing even. So, well done, and hope you help more people who are suffering, mentally or any pain
Mm.
management. So yun. Thank you, Ryan, for your time today.
Yes, and
Thank
thank
you,
you for
thank you for the opportunity.
inspiring all our Filipino nurses na to diversify, 'di ba? Hindi lang working in a hospital ang future or your current work. You can also start your own business, be your own boss like what Ryan did. And yeah, he parang sobrang driven talaga si Ryan, no? Alam niya talaga yung mga steps yung gagawin niya para ma-achieve yung business na yan. And I think that's important to have a successful business. So hopefully after the expo, you have more Filipino clients and
Yay!
ayan. So 1 hour, 8 minutes. Ang dami ko pang gusto itanong pero thank you so much for the time, Ryan. And we'll see you on March 2.
Yes, can't wait. See you guys. Salamat sa opportunity. Thank you for the opportunity. Thank you.
Thank
Thank
you.
you.
We'll end
Good
the stream.
evening.
Bye.